Good afternoon, Hattiesburg. Thanks for joining us for this COVID-19 briefing for Wednesday, March 3rd. We'll start with today's numbers. These are system-wide numbers for Forest General and Merit Health Wesley. As of this morning, there were 44 patients between the two hospitals who are COVID positive. That's 10 under where we've been for the last 2 weeks, with one person under investigation. And of those 44, 12 are in the ICU. Our numbers continue to head in a downward trajectory, which is a good sign, getting closer to that single digit in ICU admissions. We hope we get there very soon, but seeing hospitalizations now reach where were in maybe late October, again, a positive sign for us. Statewide today, there were 380 new cases reported with 19 new deaths. None of those deaths were in Forest or Lamar County. Today, new positives up just slightly. Forest County had 17 new positive cases. Lamar County had 12. And since this began, Forest County has had 7,234 total infections. Lamar County has had 5,896. The 5-day average, also a promising sign. Both counties now under 20. Lamar County now at 5-day average of 8. So we hope that continues as well. The inside 14-day number is the number of people who have tested positive in the last 2 weeks. It gives you an idea of how many active cases you could have in your community. 308 right now in Forest County, and in Lamar County down to 202. Again, staying right at the 500, but a significant downward trend over the past month, and hope that continues as well. Compared to a week ago, Forest County was at 348 inside 14 days. They're down by 40 a week later. Lamar County is down by almost 80, so a significant drop of almost 120 in our metro area. Hospitalizations down as well, 53 to 54, and then ICU 12 as it was last Wednesday. Our goals continue to be protecting the vulnerable, preventing overrun of the healthcare system by slowing the spread, and then prioritizing public health while giving the private sector the space to continue operating. Today we sat down with Dr. Bryan Batson and had a conversation kind of about what goes into herd immunity, where are we in terms of our community's overall vaccination efforts, where is that going, and also about the new J&J vaccine that's now come available. And so here's our interview with Dr. Bryan Batson. And Dr. Batson, first of all, thanks for being here. We obviously, the subject of herd immunity, particularly as vaccines become more widely available, and right now we're at people over 65, people between 16 and 64 with underlying health conditions, first responders, teachers, healthcare professionals. At what point, in terms of percentages, do our two counties, Forest and Lamar County, when do you start considering herd immunity taking effect?
Yeah, tough question, Mayor. I mean, it's really a hard one to give a specific answer to because it's a little bit like a moving target. Many of us would love for it to be an on and off switch where we could just wake up one day and, great, we're at herd immunity. It's a little more complicated than that, simply because there are so many factors that influence herd immunity, including how many variants of the virus have appeared, what is the vaccination rate in your community, and how many people are mobile. Where else might they be contracting the virus outside of your community? So it is certainly something that we think of and imagine as a finish line per se. However, it is a bit of a moving target. It's like we've got pieces of the puzzle, but somebody can add new pieces to the puzzle or take some away, and it changes that target a little bit.
Do you think that getting 50%, 60%, is that put us on the way? Obviously, we're not there yet. I mean, I think as of yesterday, Forest County had about 15,000 who had been vaccinated either first or second dose. Lamar County was around 20,000. And at what point, 50%, 60%, do you start saying, hey, we're making real progress here?
Sure. And first, I think those numbers you quote are outstanding. And I think we should be really proud of that as a community in Forest and Lamar counties and the great efforts going on at the Convention Center and through HealthWorks. The vaccination rate in our community is really high. When we look at what number, what percentage of the population needs to be quote unquote immune, whether that be with vaccination or having had COVID, That number has varied depending on which experts you talk to. Dr. Fauci and other infectious disease experts give a range somewhere, some as low as 65%, but some say that vaccination and immunity needs to be as high as 80-85% in order to achieve herd immunity. So somewhere in there, in that range. Just another example, ABC News did an interview with 4 infectious disease experts in California yesterday, 4 infectious disease experts in that state, with the question being, when will California reach herd immunity? And 4 different answers were given. Again, telling you that this is not a simple, if we get to X number, then the light goes off and we're at herd immunity. But somewhere in that range is the most widely accepted number, somewhere in that 70, 75 to 80% range that we would need to get to.
And what do you think in terms of the next population that might become eligible to get a vaccine? Obviously, teachers and first responders were added last week, but which population do you think is next?
We would expect the general community to start coming online fairly soon, with the projections of how many teachers and first responders have already been vaccinated, because they either were above 65 or had an underlying health condition. Adding to that, the healthier teachers in this week, we expect that things will be moving more rapidly, tied with the fact that there are more vaccines available now. At the Department of Health sites, they added thousands of additional slots over the last couple of weeks, which is great. And the HealthWorks facility continues to add slots as well. And
so far, we've only had really 2 choices. We had Pfizer and Moderna. The next one coming out, obviously the news this week is J&J coming out, and the Department of Health is going to have sites. And what have you heard about J&J in terms of the effectiveness of this and kind of how it developed over time?
So J&J is different from Pfizer and Moderna on one major aspect, and that is it's a single shot instead of the 2-shot series that is required of Pfizer and Moderna currently. Additionally, it doesn't require as many freezing specifics, so it doesn't have to be frozen as low a temperature. However, it is a multi-dose vial, so there are 5 doses per vial, and once that vial is opened, all of the doses must be used within 6 hours with refrigeration. So it's not as simple as what is called a single-dose vial, where one patient comes in and you can administer one vaccine. It is still a little bit of a logistics challenge in that when you open a vial, you really need to have 5 patients in order for no doses to be wasted. Adding to that, the information regarding the J&J vaccine isn't very encouraging. It's an excellent vaccine as well. Some have pointed to the numbers with J&J as being slightly lower than Pfizer and Moderna, but we have to put in context that J&J vaccine was studied under very different circumstances. As new variants have come to be part of the equation, Pfizer and Moderna may not be quite as effective if studied later in time and in a different geography like J&J was.
And so would you recommend in terms of like how it's going to be rolled out? Obviously, any vaccine right now is a good thing for people to get equipped with. And so the J&J vaccine is still effective, just under a different set of circumstances. It was developed rather than the other 2.
Correct. All of these vaccines are excellent choices, and getting any of the above is a good idea. Obviously, a lot more convenient with the J&J vaccine in that it's a single dose, but all 3 are very effective.
And as we look forward, and obviously people are now getting their second doses. Some folks have already moved past the 2-week window after their second dose, so they're considered fully immune. What would you say to folks in terms of just their overall behavior after that? I mean, do we still need to wear masks? Do we still need to socially distance, that kind of thing?
Yeah, absolutely. This is one of those things that we talk about with our patients as they get vaccinated. Getting the COVID vaccine is not kind of a panacea. It does not give us complete protection against COVID. It's certainly not 100%. So continuing to do those things that we've done over the last year that are effective in reducing the spread of COVID remain important, because even though I may have been vaccinated, it is still possible that I may be a carrier of the virus. And we know that patients that are, children that are under 16 aren't even eligible for the vaccine yet. So it remains important for us to remain smart and continue to do those things that we can do to reduce the spread of the virus. We have good momentum. Things are looking better, and we don't need to take our eye off the prize of what we're heading toward.
Okay. Any last words to our folks out in the public who are, again, we're almost a year into this, and any word to them in terms of where we go and kind of what we need to be doing as a community?
Well, I just first want to again thank all the healthcare workers who have just spent a year serving this community in such an honorable way. It's been an honor to serve with them in this fashion, and also to our community to recognize that we all have a part to play. As we've said many times throughout this journey, it is a marathon, and we all need to be working together toward a solution. Otherwise, that marathon just becomes longer and longer and longer.
All right. Dr. Bryan Batson is CEO of Hattiesburg Clinic. And Dr. Batson, thank you for all the work that your clinic has done, and stay safe.
Thank you. You too.
I want to thank Dr. Bryan Batson for joining us today. Dr. Batson, along with our other healthcare leaders, Matthew Banks at Marriott Health Wesley, Andy Woodard at Forest General, and so many others, have led our community's response to this COVID-19 pandemic for almost a year now. They have had to serve as the people who motivate and coordinate care, and we just appreciate their teams who have had a rough couple of days in terms of trying to continue vaccination efforts, take care of people, dealing with changing regulations and questions surrounding that, as well as the conversation those things always spark on social media. So to all of our healthcare workers, we say thank you. Today I signed Executive Order 2021-3. Specifically, this order follows the state guidelines and the state's lead on lifting limits on capacity and operating hours, particularly when it comes to our restaurants. However, it does continue all mask mandates, as I mentioned yesterday that we would do. We believe that masks are the way to keep the progress going to try and bring this pandemic to an end while more people get vaccinated. And so this will continue social distancing guidelines for those businesses, particularly on the retail side, and follows the other state guidelines and recommendations on all other business operations. No matter what we put into effect in terms of executive orders, I mean, it really does come down most of the time to personal responsibility and taking care of your neighbor by just doing the right thing. And I really encourage you to remember that as you go about your daily business. Our businesses, particularly restaurants and bars who are affected by this, we want our nightlife to come back. We want our hospitality industry to do well. And so I've talked to many of them today. They understand the importance of enforcing mask requirements to try and make sure we don't see an increase in our numbers. If we do see an increase in numbers, we will respond accordingly as we have throughout this pandemic. But this is a time for us to continue doing the right thing to try and bring this pandemic to a close, and I ask your help in making that happen. Some city news. Paving continued this week in Ward 3, Shadowwood Drive and Huckleberry Lane. This is a subdivision off of 40th Avenue that just had some water lines replaced last year, and so the paving now has taken place. We'll be moving back to Ward 1 later this week and going into next week. And finally, our act of courage. Last night brought a heartbreaking loss to our Hattiesburg High Tiger boys basketball team. Fought hard until the very end. It was a great environment at the Jackson Coliseum. And our guys, a relatively young team, made it all the way to the Final Four. And so to Coach Watson, Coach Wade, to our players and their families, hold your head up. In a difficult year, you did so much more than was expected. And so we look forward to seeing you in action next year. As we continue in the week, remember to wash your hands, take care of yourself, wear a mask if you're out in public. Do on what is essential. Remember, you're safer at home. Have a good evening.